Hi, this is Klifton Fehr, and this is Fehr is Fair. Let's talk about substance use disorder. Substance use disorder is a mental health condition in which a person has a problematic pattern of substance use that causes distress and/or impairs their life. Substance use disorder, or SUD, exists on a spectrum and may be mild, moderate, or severe. It typically involves an overpowering desire to use the substance, increased tolerance to the substance, and/or withdrawal symptoms when you stop taking the substance. Addiction is the most severe form of SUD. It involves continued substance use despite negative consequences. Addiction to substances happens when the reward system in your brain takes over and amplifies the compulsive substance seeking. Both involve the development of physical dependence and psychological dependence. People are psychologically dependent when a drug is so central to their thoughts, emotions, and activities that the need to continue to use becomes a craving or compulsion despite the negative consequences. With physical dependence, your body has to adapt to the presence of the substance, and withdrawal symptoms happen if you suddenly stop taking the drug or you take a reduced dosage. These are the leading symptoms of substance use disorder: withdrawal from friends and family,
go away,
sudden changes in behavior, engaging in risky behaviors, developing a high tolerance and withdrawal symptoms, feeling like you need to be able to function, extreme mood changes,
let me in, let me in,
confused thinking, problems concentrating, avoiding friends and social activities, and thoughts of suicide. These are just a few examples of symptoms of substance use disorder. According to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, the signs of substance use disorder include taking the substance in larger amounts and for a longer amount of time than you're meant to if it's a prescription, having a strong desire or urge to use the substance, having unsuccessful efforts to cut down on or control substance use, spending a lot of time obtaining or using the substance or recovering from its effects, having issues fulfilling responsibilities at work, school, or home due to substance use, continuing to use the substance even when it causes problems in your relationships, giving up social, occupational, or recreational activities because of substance use, using substances again and again even when it puts you in danger, continuing substance use despite of an ongoing physical and psychological problem that's likely caused or worsened by the substance, developing a tolerance, which would be defined as the need for increased amounts to get the same effect, and experiencing withdrawal symptoms, which can be relieved by taking more of the substance. Seeking medical care as soon as you have signs of substance use disorder is essential.
do it! It was...
Remember, these are just a few examples. One may ask, how does substance use disorder develop? The progression to a substance use disorder often follows this pattern: experimental use or prescription use, the occasional use or using prescriptions not as directed, heavy use, or substance use disorder. The substance's effect on your brain chemistry, genetics, mental health conditions, access and exposure to the substance, and adverse childhood experiences. This is Klifton Fehr, and this is Fehr is Fair. Like, follow, and subscribe so you don't miss what's coming next. A therapist is ultimately responsible for making sure that whatever question you have is something that we can cover within a session. We want to make sure that you're ultimately comfortable and feel safe in that space that you're occupying within the therapeutic process.